These are some of the more than 350 TMA physicians, medical students, and TMA Alliance members who came to the first Tuesdays at the Capitol event of the 2017 legislative session this past Tuesday. We'll have more on that in a bit, including comments from a physician legislator. Thanks for watching TMA's Legislative News Hotline for Friday, March 10th. I'm Brent Anir. This week, physicians testified on several priority bills: establishing telemedicine guidelines, overriding step therapy, the question of guns in certain hospitals, and a quick chat between a TMA trustee mentor and a TMA Leadership College scholar. But first, improving the mediation process in balance bill situations. Thursday, the Senate Business and Commerce Committee took up Senate Bill 507 by Senator Kelly Hancock of Fort Worth. TMA supports the bill as it expands mediation to all out-of-network physicians and healthcare providers at an in-network facility, along with emergency care, and it maintains the current $500 threshold for mediation, as well as personal responsibility of the patient. Moreover, physicians retain the right to bill patients for care they provide outside of what their health plans might allow. Dr. Ray Callis, chair of TMA's Council on Legislation, told the committee TMA supports all of these provisions. He said mediation is working. 95% of billing disputes are resolved in the initial informal mediation conference call. He added 1,677 cases were mediated last year, compared to just 14 cases 7 years ago.
This is something that's going to allow patients not to get these surprise or egregious bills, but give them an avenue. If they get one, then they can come through a mediation process.
The committee left Senate Bill 507 pending. TMA also calls for stronger enforcement of current insurance network adequacy laws. And another part of TMA's plan to address the surprise billing problem, improving health plan directory accuracy, took a step forward. Late last week, TMA physician member Dr. Representative Greg Bonin of Friendswood filed House Bill 2760, which would require health plans to update their physician-provider directory listings each business day. We've heard stories about outdated plan directories, including deceased physicians or omitting physicians who are in the plan's network. Thursday, the Senate Business and Commerce Committee also heard Senate Bill 680, also by Senator Hancock, relating to step therapy protocols required by health insurers and prescription benefit managers in connection with prescription drug coverage. Oncologist Dr. Sylvia Jaramillo testified in favor of the bill, which would allow physicians to override step therapy protocols to better serve patients. It would allow a patient to stay on an effective medication prescribed by his or her physician, even if an insurance plan calls for a medication change. Dr. Representative Bonin is sponsoring the House version of the bill. A telemedicine bill was introduced in the Senate Committee on Health and Human Services Wednesday morning. Senator Charles Schwertner of Georgetown introduced Senate Bill 1107, which would create a framework for telemedicine care in Texas. It says telemedical services should follow the same standard of care as care delivered in a traditional in-person care setting. Dr. Ray Callis testified in support of the bill, saying it would modernize the definition of telemedicine.
From our vantage point, the bill is singularly focused on making sure that care delivered through telemedicine adheres to the same generally accepted standard of care patients deserve at any and all costs. More broadly, the bill establishes critical pathway. One, to define the establishment of that patient-physician relationship via telemedicine. Two, it requires a physician to have access to clinically relevant information in order to make a diagnosis necessary to maintain safety for our patients. Three, states very clearly that the standard of the same as in person is the same via telemedicine, and it requires health plans to make available to physicians their policies on telemedicine, including payment practices, coding claims, submissions, etc. This is likely not the last discussion we'll ever have with telemedicine, but is a dang good start as we move forward in the state.
He said this bill is the result of lengthy negotiations by TMA, the Texas Academy of Family Physicians, and the Texas eHealth Alliance, with Senator Schwertner's help. The bill was left pending in committee. TMA testified Tuesday on a bill the House is considering to allow the posting of signs prohibiting guns in 10 state mental health hospitals in Texas. The House Public Health Committee heard testimony on House Bill 14, which effectively would close an inadvertent loophole. The issue was a gun ban effective in hospitals the state licenses. Hospitals posted signs banning guns based on an old state law. Then a new law in 2015 set penalties for improper gun ban signage, and then state mental health facilities had to take down their signs. Dr. Moy says the bill will fix the problem by specifically listing which Texas Department of State Health Services facilities can post the signs. And he tells us why.
Well, HB 14 is so narrowly focused is that it was one area technically where the state hospitals were not allowed to post signage because they're not technically licensed by the state. Since the state owns and operates them, the state does not license them like other hospitals. So this bill fixes that one small area.
After hearing testimony Tuesday, the committee left the bill pending. Organized Medicine headed back to the Capitol this week for the second First Tuesdays at the Capitol event of the 2017 legislative session. As we mentioned earlier, more than 350 members of the TMA family of medicine, including 120 medical students, participated, starting with a pep talk from freshman physician representative Dr. Tom Oliverson. He discussed engaging lawmakers on some of the most important issues facing Texas medicine today, including those who seek to expand the scope of practice for non-physicians, such as physical therapists, dental hygienists, and nurse practitioners. He also reminded doctors about what resonates with lawmakers.
Tell them how it affects you. Tell them how it affects your practice. Tell them what you see in your practice. If it's a bill that we're supporting, tell them what the benefit would be for the patients in their community that you see and care for every day. You have the knowledge, you have the experience, you have that story to tell. And I can tell you that there's nothing that you're going to say to your legislator that's going to leave a stronger impression than that personal story.
The white coat invasion then headed to the Capitol for a full day of visits with legislators and staff. For some in the First Tuesdays group, it was their first meeting with lawmakers and advocating on behalf of their patients and TMA. This year's TMA Leadership College scholars also joined in as part of their training. We caught up with one scholar and his mentor, TMA Board Chair Dr. Doug Curran, recapping their day.
Well, Dr. Sam, I know you spent the day over at the Capitol on First Tuesday. That's kind of what we do. So why don't you tell us a little bit about what happened today while you were over there?
Okay. What we did was we met with several state legislators and their staff, and we discussed with them many of the issues that were important to physicians today, including Medicaid reimbursement and scope of practice. All these issues affect the practice of medicine today and how we can provide the best care for our patients.
Absolutely. And educating our legislators is something we got to do because they really don't understand what we do.
That's right.
TMA currently is tracking about 800 pieces of legislation. If you were not able to attend this First Tuesday here in Austin, you might consider visiting your legislator in your home district or attend the next First Tuesdays event in April. That's it for this week. I am TMA's Brent Anier. Thank you for watching, and please join us again next week for TMA's Legislative News Hotline.